name's Devin. I'm going to be your nurse today. I have got an order from the doctor to put a urinary catheter in. So can I get you to confirm your name and date of birth? Do you have any allergies? Are you allergic to iodine, betadine, or latex? No? Okay, good. So what we're going to do is we're just going to put a tube into your bladder. It's just going to relieve some of that pain that you've been having. It should only be a minimum discomfort. If you feel any severe pain, just let me know. So do you have any questions? Okay. So I'm going to make sure the bed is lowered and they're in a supine position and the thighs are apart. And I'm going to begin with doing perineal care. So I'm going to pull the bed down. Now I'm going to wash my hands and put on clean gloves. And with doing perineal care, I'm going to be using soap and water, and I'm going to be cleaning in a circular motion with the meatus and down the shaft into the pubic bone. Make sure it's dry. After I do that, I'm going to wash my hands again, and now I'm going to get ready for the urinary catheter. So I'm going to get the bag, pull it out. I'm going to use this as a trash can. Okay. So when doing this, I'm going to put this one out first, then side down, and this is a sterile field. There's a 1-inch border of sterile, and if my uniform was to touch it, that would be a contamination, and like if a clean hand touched a sterile object, that would be a break in the sterile field. So first I'm going to start off with my sterile gloves. After I put on my sterile gloves, I'm going to get this drape and put it over my patient.
Yeah, don't do that this time because I should have kept going. Kind of sort of. I forgot I was going to bed. Like, just put it on.
Okay, and now I'm going to go ahead and get this together. I'll go ahead and take the specimen container and put it on this for later. Then I'm going to take the cap off of the lube. Go ahead and get the catheter out and make sure it stays together because this is sterile. Okay, now I'm going to go ahead and put the syringe into the balloon. Go ahead and attach it. And after that, I'm going ahead and put the betadine onto my cotton swabs. So get it with that and drop it in the trash can to make sure it doesn't touch anything. So I'm going to grab the penis, but now this is a clean hand, so I can't touch anything else. So I'm going to get the first cotton swab and clean in a circular motion, then throw away. Put another cotton swab, another circular motion, and throw it away. Then I'm going to clean down the shaft, throw it away, and shaft again, throw it away, and then clean the meatus one more time. Now I'm going to insert all of the lube into the penis and then throw that away. Now I'm going to get ready to put the catheter in So I would tell the patient to bear down as if they were using the bathroom and just take a few deep breaths to relax. And I would put it all the way in for a male. And then I would grab the tip with my non-dominant hand and insert all of the water into the balloon. And then I would take it out without letting up on the pressure. And throw that away. So once the balloon is inflated, I would tug, make sure it's in the bladder, and then I would tape it to the abdomen. So now I'm done with the sterile portion of the catheter, and I would go ahead and move this, and I would put this on the side of the bed. And make sure it is always below the bladder. And I would not attach it to the side rail, I would attach it to the bottom of the bed. So I'm going to go ahead and take my sterile gloves off and throw everything away, get out of my way. Okay, if I was to obtain a specimen immediately, I'd get my cup and come down here, and I would unclip it. And I would had clean my hands and put on clean gloves for this. And I would just pull this and pour it in there, and then lock it back and clip it back. And this would be on the edge of the bed. I'd close it, label it, and send it off to lab. Now, if I was to get a sterile specimen, I would get it from the port if this was a few hours later, and use a syringe and just get it from there. And before I leave, I would have made sure the bed is lowered. They're in a semi-flowers position, the bed's locked, call lights in reach. I would ask the patient if they're in any kind of discomfort and if I could help them with anything. And again, I would make sure this is below the bladder. So, if I was to come in later on, the doctor gave me an order to take out the specimen. I'm looking for the syringe, but I don't see it. Okay, so the doctor gave me an order to take out the catheter. So I'd come in and say, my name's Devin, I'll be your nurse today, and the doctor told me to take out your urinary catheter, so I just need you to confirm your name and date of birth, and confirmed with the wristband. Okay, it's going to be a short and easy procedure like before. You're just going to take a few deep breaths, and that's going to help relax you, and I'm just going to pull it out. Let me know if you have any discomfort. I would empty out the urinary bag, and I would draw out the ring. And then I would pull out. And I'd have also had clean gloves on for this procedure. Then before I leave, I'll make sure there is no comfort again. And make sure their bed's locked and their side rails are up and they're comfortable. Okay, I hope you have a great day.